Institute of Development Studies, just here. And so we'll be talking about food security and nutrition, and I shared this session with Rob Hughes, who will talk about how can we think about interventions in terms of food security and conflict, and I will kind of set the stage to Rob's part by looking at what we know from a research perspective about that. But just if you look at a classical framework to think of how armed conflict can impact household welfare, there are certain numbers of channels through which armed conflict is detrimental. First one is change in household composition, of course, due to killings in the general population. So it results in, for example, in Rwanda, was massive increase in the ratio of female-headed households because young males tend to be the prime target of conflict. Destruction of assets, and especially productive assets, of course. I forgot here, but destruction of infrastructures, roads, healthcare facilities, and so forth. Forced displacements, which is a very, very important channel through which armed conflict impacts on people. Disruption of markets, of course, decline in production, collapse of economic growth. Just as an add-on, distributional effects to make sure that when we think of conflict, some people might gain out of the conflict. So it's a man-made disaster, and as such, it can also entail some distributional factor, but I will not talk about that today. So when you took this framework and you want to look at food security and how armed conflict affect food security, you will see that most of these channels are actually relevant on food security. The change in composition of the household, of course, lowers the earning capacity of the household. Disruption of markets lowers the availability of food products and also lowers the earning capacity of households. The collapse of production, especially food production, reduce available food. There is also a link between having food surplus and at an individual level and being targeted by the armed groups, which of course discourage production of food. Of course, armed conflicts create a very adverse environment for intervention of the state or non-state actors to deliver aid and so forth. So we have a very strong stream of reasons why armed conflict should create massive food insecurity. But it is actually quite difficult to quantify this because, of course, in the midst of a conflict, there's very few data. So the quantitative literature very recently has sprung and tried to look at this and basically try to look at it through the nutritional status. So when you try to look at how armed conflict impacts food security, well, you don't know exactly what happened during the conflict, but we can look at what happens after and what you can still measure after. And what we can still measure is usually the nutritional status, especially of children, which is something that can tell about what happened in the past. So the researchers have used a lot of anthropometric measures, and especially the height for age Z-score, which is one of the most common anthropometric measure. And the height for age as a nutritional indicator is a very cumulative one. So we see growth deficit if the food intake is not good enough, and then the child will not grow on par with its potential, creates a deficit, and this deficit will never be completely recovered. And so when you look at the height of people, it basically tells the story of the history of food nutrition, nutrition. So there have been a development of household surveys in most conflict countries. So basically we do have baselines before the massive conflict with a lot of information on nutrition. And researchers have basically come back in these countries after the conflict ended and collected similar data on nutrition to try to see what happened. So I will maybe just a few. Yeah, what's interesting with the height for age, just before I go to the evidence, is nutrition gives a strong, if you will, look at the long-term impact of the conflict. This is a very important point. Is the inadequate nutrition, especially in early life, early stage of life, creates a very long-lasting set of consequences, especially in terms of cognitive abilities, also and then educational attainments, of course, subsequent height and health, mortality, labor market outcome, even marriage outcomes have been shown to be impacted by what happened in the very early stage of your life. And then within the country, usually, not every regions are affected in the same way or not at the same time. So it creates variations within the country that can be used by researchers to compare basically the health of children affected versus children not affected or less affected. There remains a big problem of causality if the regions that are poor and hence with a lower nutritional status are those who are likely to be more impacted by the conflict. So to get around this, we need to find some sources of variation in conflict that are not related to nutrition. I will not talk about that today, I have no time, but there are, for example, distance to borders, but to find some geographic characteristics of conflict location. So what we learned is a snapshot of some studies. All of these studies have been published by a network called Households in Conflict Network, which is based in IGS. And it brings together researchers from all over the world. So first is by Gunderwood, Akresh, and Verwijk in Burundi. And basically what they found is each additional month of exposure for children reduces by 0.047 standard deviation the height for age Z-score. Now when you look at the average duration of exposure, was usually about 2 years, I think, and therefore it resulted in an overall impact of 1 standard deviation. Put that a bit in context. If your height, conditional on your age, is similar to the reference population, your height for age Z-score will be 0. There's no difference between your height and the one of well-nourished children. When you have a Z-score of -2, considered to be severely malnourished, and here the average exposure to conflict in Burundi was responsible basically for half the gap between a well-nourished child and a severely malnourished child. Half the gap just by the exposure to the conflict. Akresh and Al did a similar study, a historical study on Nigeria, which is the Biafra war, so it's quite far back in time, but they were able to get data on cohorts and try to look at what happened for people who were born during the Biafra civil war in Nigeria. And they did find also a quite strong effect. What's interesting in the case of Biafra, what they found is the girls, because mostly girls in their sample, who were adolescents when the conflict broke out, were actually more affected than the very small children who were 0 to 3, which is a very surprising result because growth velocity is, of course, higher at very early stage of your life than later on. So usually we think that the impact is greater the smaller is the child. But they do find that in Nigeria, as you can see, for the adolescents, they lost 4.53 centimeters in average, respective to their peers who were living in another part of Nigeria, not affected by the conflict. Whereas for the smaller girls, it was less than 1 centimeter. So that's an interesting result from Nigeria. Then from some evidence between, in terms of the war between Eritrea and Ethiopia, and Akresh again and with co-authors, they were able to get data from both countries. And they did find that the height for age Z-score of children born in Eritrea, in conflict-affected zone in Eritrea, lost between 0.77 and 0.89 standard deviation, which is extremely high, and was actually higher than in Ethiopia, which is 0.3 and 0.4, which also reflect the tipping force in this conflict. More evidence from Iraq, the US intervention in Iraq, not only US actually, but the international community intervention in Iraq created, of course, big disruption in food delivery and also a lot of insecurity. And Gerald Serban found that an impact of 0.4 standard deviation, which is quite high. When you think of Burundi, it was about 1. Burundi was a massive civil war, which lasted for several years. And in Iraq, although it was much shorter in time, it also resulted to 0.4, which is very, very large. So I will not go through all of them, but what's interesting then is, for example, Verwil was able to relate the nutritional status to probability of mortality. And basically, thanks to his first study, where he was able to look at how nutrition was impacted by conflict, and then he was looking at how this impact on nutrition affected the probability of dying for children. And we did find a very strong impact, especially for boys. This was the mean impact for boys, and it leads to a 25% heightened risk of dying for children. So it is, and Bunderwood in Burundi related the fall in nutrition status to educational attainment, and also found a large difference. So it leads, of course, to some questions. The first one is malnutrition impact of food insecurity? Is it really mostly concentrated on the young children? Again, we saw some evidence that it might not be so. So that should trigger more research. Intra-household allocation, who bears the brunt of this nutritional consequence? And of course, identifying the precise mechanism, which something this literature cannot really do, because again, we have data before and after, but what are the precise channels through which this nutritional impact is created? So I will very just 1 minute, sorry, Rob. Speak of food security in Naxal-affected regions in India. That's my own research with colleagues at IDS. This is just to show that it's not only massive civil war that creates big food insecurity problems. What we did here is we looked at Andhra Pradesh between 2002 and 2006, which was home to an important Maoist guerrilla called the Naxals. Although it is violent, it is by no means comparable to Burundi or Iraq or these kind of countries. But our research question was, do children exposed to this guerrilla were less able to withstand effect of drought? So basically the combination between natural disaster, drought, and man-made disaster, which is this guerrilla, Maoist guerrilla. And we did find, using a ceasefire which created a nice discontinuity in violence, this is the impact of the drought for children living with the guerrilla, which was one standard deviation, absolutely enormous. And during the ceasefire, so when there was no violence whatsoever, the impact of the drought was reduced to 0.4, basically. So the massive impact here, we can attribute that to the presence of the violence from the Maoist guerrilla. And this, again, is not a civil war type situation. So I will now leave the floor to Rob, who will talk to you about how can we intervene to mediate this sort of impact.
Thank you very much, Jean-Pierre, and thank you very much for inviting me to come and talk. I might just stand here so that I don't have to keep back. My name is Rob Hughes. I work at the Department for International Development, and I, at the moment, cover Pakistan and Yemen, and also do a little bit of work in London on nutrition. And what I'm going to try and talk about is this really follows on quite nicely from what Jean-Pierre said, and really is about what challenges does this create and what opportunities are there when we think about how to actually respond to those complicated set of problems in crisis and conflict. And I'll keep an eye on the time and do intervene. Very briefly, I will unfortunately give another disclaimer, and then I'll talk a little bit about Yemen, something about the need, something about the context, the sort of wider context that we actually have to think about what to do in, before looking at what implications that has for our thinking and how we need to respond. And finally, I'll leave us with some certainly more questions and challenges than answers. I am also not speaking on behalf of the government. I'm not talking about government policy, but that's not really because I'm going to say anything wildly controversial or wildly different to what different policy is. It's more because actually I'd like to try and be a bit more reflective and think how we actually respond to this, rather than read off the policy guidance that you can find on the internet. Yemen, extremely poor country, poorest in the Middle East, very low in the Human Development Index, and perhaps more importantly, the trajectory is going down, 154th. And I think this is a useful time to sort of think about what does nutrition capture. I've actually been working on nutrition since about September, and it's really one of those fascinating things that I think as a doctor and in medical school and studying public health, I certainly didn't give it enough attention. But actually it's a really incredible barometer for development, in that this model on the side that you probably can't all read at the back, and that's not a problem because it's the shape of it gives you a clue, really illustrates some of the main determinants of child malnutrition, or malnutrition in general. And it makes the point very clearly that it's more than just about food, it's about food and disease and prevalence of disease and all that determines that. So the complexity of this diagram, and this is a highly simplified diagram, illustrates just how much funnels down into the outcome that we're looking at of nutrition when you have a stunted or a acutely malnourished, wasted child. So I think it's an interesting barometer, and the fact, that's an interesting sort of link to the fact that in Yemen has the second highest rates of stunting in the world, and one of the highest rates of wasting. It's around 15% of children under 5 are currently acutely malnourished, and that is exactly the same level that the WHO say is a sort of crisis level, so it's with the title. And the chronic malnutrition is a long-standing problem, and it's not new. The wasting rates have probably gone up a bit, but that's, and actually some of this data, we just had some new data that's slightly changing that. So when you look at, going back to this model, there's an awful lot of determinants there. It goes right the way from the bottom: the political resources, the political economy, the economic structure, political and ideological superstructure, formal and non-formal institutions. There's a whole lot there, and we obviously can't sort of cover all those. And actually, when we're thinking as DFID, what can we do? We have to be quite realistic, I think, and that's one of the things I'll come to in the end. This is the current situation. This is the most recent data we have. This whole coastal Tehama plain has extremely high rates of global acute malnutrition. That's greater than 15%. So it's pretty poor, but quite mixed picture within the country. And actually, more importantly, this data, we have to take it with a big caveat that Yemen is an extremely difficult place for everybody who's from outside Yemen to operate in at the moment. That makes training, data collection, even data analysis quite difficult. So we kind of have to put it in the context that it existed. The broader context to this, there's chronic and ongoing instability in Yemen that I'm sure many of you have seen, have read about in the newspapers. It's an extremely complicated conflict situation. In the north, there's a Houthi rebellion around the border with Saudi Arabia. In the south, there has until very recently been reasonably large areas of territory actually held by Al-Qaeda in the Arabian Peninsula. And there's been part of this Arab Spring uprising of mass political mobilization in Sana'a and in other cities around the country. And that's had extremely important knock-on effects to the whole economy, which is particularly relevant in a country that imports about up to 90% of its food. Thinking again about some of these kind of basic fundamental issues, the gender and sort of dynamics within Yemen are extremely complex, and I think certainly I'm aware how complicated they are and how little we probably know about them. We certainly know that there's extreme limits in some populations on where women's ability to decide what they do with their resources, how they travel, where they basically when they leave their house. The societal structure is often simplified into saying it's a tribal structure. It's very complicated because it's tribal with all sorts of variously fragile and strong allegiances, and then this whole insurgency in the south. And then there's the politics, and the politics extend out from a complicated country, if you look at it on its own, to the region, extremely important regional involvement, particularly the neighbouring countries are obviously, as you'd expect, interested and concerned about how to engage with Yemen. And then globally, I think one of the really obvious points is that one of the reasons that countries like the UK are particularly interested in working in places like Somalia increasingly and Yemen is a complex set of motivations that include the desire to help people, but also include an element of self-interest and ensuring stability and security of the UK. And that's similarly to the discussion we had before the break around the military and the roles of the military. There's some tensions there. Just before, I haven't got long left, but just thinking about what that means in terms of us programming and us deciding what we think the UK taxpayers' money should be spent on. The most sort of obvious one to me when I go to Sanaa is the personal security and the access that we have. We have an extremely robust sort of security setup in Sanaa, and that's through well-documented examples of attacks on the British in Yemen. So it's justified, I think, but it's also quite restrictive. It means it's very difficult for us to get out of Sanaa, and it's quite difficult. We're sometimes limited where we can go in Sanaa. And we really need to think quite carefully about where along that causal chain we want to engage. I think there's a temptation, and there has been a temptation, to really think quite sort of proximal to the causes. So saying, well, what are the immediate causes? And even actually beyond that, not even thinking about what are the causes, but how do we treat? So we have high levels of acute malnutrition. We need to treat starving children. I mean, that's very simplistic, but actually how much do we extend that out into thinking about prevention? And how can we do that given the setting? Again, more questions than answers. And we need to really be quite strategic about our ambition and our engagement, I think. And I think there is an element of meeting immediate need, even though it's probably not the most cost effective, but there's this humanitarian imperative, and we really do want to respond. And I think that certainly fits into this broader politics about actually us wanting to show that both the UK is trying to support ordinary people's lives in Yemen getting better, or at least not getting worse as fast. But we also need to think about the bigger picture and supporting positive change in that. So I'm going to leave it there in case we have a minute or two, maybe not a minute for questions, but these are something we'll discuss this afternoon. You know, how should the UK engage, and how much should we push up that causal chain? There's a very important set of questions about actually who do we have a duty of care for that often impinge on what we think we might want to do. Certainly when the UK travel advisors do not go to Yemen, and if you're there, leave, it's quite problematic for us to bring in partners who are going to deliver some of the things we'd like to deliver if they're from outside. It's also quite difficult for us to work with local partners when we have such limited travel. And how far does that duty of care extend to? We certainly work with a lot of non-governmental organisations in Yemen, some of them international, some of them who bring in international staff who are not quite the same threat against them as there is against the British government, but there's certainly a security risks for them. And finally, this one that I think is really interesting is how do we measure the impact we're having? If we want to try and be ambitious and try and push what we can do, how do we measure that? And how much can we, we have a responsibility to try and measure the spend of taxpayers' money, quite rightly, but how much can we do that in this setting? And where do we have to be flexible about that? So those are lots of big questions.